working with the palmar reflex. Now, the palmar reflex, your palm, most people think is open and close, and they think the reflex is like this, just a snap. So children are either fisted or not. There's more that goes into it. First of all, you have to learn the evaluation techniques. First of all, for the evaluation techniques you have to look at is vision, right? Vision is a main component, but also skin tonus. When you are born, right, the whole point of your epidermis, your skin, is to regulate gravity. That's why the absolute horizon comes into play. So if a child doesn't get their absolute horizon, right, they're going to have hyperreflexes because they don't know lying down. They don't have to lie down. They're sort of like floating on the table. And this is where you get CP or cerebral palsy, where you have that spasticity or the dystonia starts to kick in, right? Because they don't know lying down. With genetics, low tone, you're lying down almost like you're going through the floor, right? You just don't know where that position in space. And with an absolute horizon, I can put a baby down, bring the baby up, and they just sort of float in the air, and then they will have good reflexes, right? So why is that important? That regulation of gravity, that's actually what a reflex is. Your bones do not know any kind of pressure. They don't articulate in fetal development. So you have a fetal neutral, right? One of the things that I'm representing in this fall at Charles University is the gravitational reflexes responses. Gravity is a stimuli, and we have different responses, like coming off the floor, coming to the floor, hanging upside down, so forth, that we regulate gravity in, and they are a reflex, or the body has to go through these stages. So palmar is one of the first oppositions to gravity, of breathing, right? And then you're going into those kind of things. The whole point of palmar, almost like seaweed in water, the hand needs to move through gravity all at the same rate. When a hand is fisted, that exploration of gravity is not present. When a hand's floppy, or especially so much so that they have contractures, gravity is actually being so much weight on the body that literally the child can't present or oppose gravity because they can't make a rotational movement within the hand to present the wrist work that needs to do, and again, palmar. Think of a little plant that's starting to grow out of the water or out of the soil, right? All of those kind of things. This is what palmar is. It is not an open and close. Open and close is a really rote, very immature way of looking at a really sophisticated reflex. The same thing with the plantar with the feet. The feet kind of wave the baby toes, right? They shouldn't be engaged. They shouldn't be engaged. They shouldn't be, literally, again, where gravity is just like a weighted blanket on their little things. So that's, first of all, you have to go. And what vision comes into play too is, again, that convergence, that coming in midline. So when, for an older child, right, these are the boxes that you have to check off, right? So if you've gone through all of those and go, oh, okay, Michelle, I see an issue with the birthing process. You want to almost take the breathing course all over again, but just work on that tonus of the body and see if we can start regulating the epidermis more efficiently. One of the biggest problems with premature kiddos is that their skin is grown at 30 weeks, right? But their bodies aren't. The baby in the fetal development will grow a pound every week, right? When that doesn't happen, they look like they're born with big old overcoats. Or I still remember Ella in South Africa, they used to just call her chicken bum, because she just looked like a plucked chicken. And again, this is parental love. This is not, a stereotypical thing. And so those are things that the images that might come to mind. Well, again, the epidermis didn't have a chance to set up that system with gravity, and that's where you're getting a lot of the spasticities that are going on. So it's not really about reflex integration, or you're going to push a trigger point. You've got to look at this tonus of the skin in relationship to the body, but also, did they learn that when they were younger? Almost like a pair of pantyhose or some Spanx, where, it just regulates all these movements that you're going into. And now you have to look at it going into the hand. You've got to work with the hand. Again, when a baby first goes to grab something, and I just did a review on this today, it shouldn't be a hyper grab, right? I don't want to hear it at 2 months old that a child can hold something. And I'm just going like, oh my gosh, no. Right? Because what happens is now, first they start dealing with the atmosphere and going through gravity, and then they just go through things. Things just go through their hands. There's no good touch, there's no bad touch, but they're just experiencing all of those kind of things. This is where you're telling them, don't scratch your poor little faces, don't, because again, nothing to them, you know, remember, babies stick their fingers in sockets. We're the ones that say, no, don't do that. And that's where parental advice comes in. But when they're starting to work with that, so don't look at when you're working with Palmer as something to be held. You really want to go in and just allow that experience. And I can tell you right now, they won't have the push. This is also when the push-pull milestones come into play. This is where you start touching breast tissue, right? That's one of the first push-pull milestones. And a baby's going to learn how to regulate. It's one of the biggest things to overcome with cerebral palsy is basically they go to push open a door and the door pushes back on them because they can't regulate that. That's what the bone function, one of the biggest movements that the skeletal function is there for, is to regulate that. But they have to do it with their skin. And this is ATNR, right? Now you can see it as skin and bones versus a fixed position and a fixed position. When I do this, my scapulas start to cross midline and to engage and release off the system. That's what ATNR is. So it's a new look. It's a lot of information, but really look at the breathing course and just apply it first to their system. Do that same touch to the hands. Let them to start to feel that tonus in the hands. Because the amazing things about our hands, right? I can touch anything, just a touch. And my body knows from experience of holding this ball, but also the touch, I don't need a lot of effort for this sucker. But if I use the same lack of touch to pick up, let's say, my doll, I'm not going to get too far. That little touch, I'm already engaging muscles because I know I have to pull this child up to do something like that and do different than I would something like this. It doesn't take much, but this is why kids have a hard time with the pencils, because they can't, they're either putting too much force into it or the lack thereof, right? And this is the gorgeous part that happens with reflexes. They're not startles, guys. They're integrations on how to move, but it regulates and adds to the quality of movement versus to the lack of movement through startle. I don't know who gave everything a startle. The Moro is actually how to move all my appendages like a little jumping jack on the table. My pelvis is the only part of my body where movement can go in all directions and still function, right? I can do movement out my elbow, but in my elbow, but I can't go in all directions and I can't create movement with my elbow. I can with my pelvis, and that's how that works. So Moro allows, almost like starting a lawnmower and going into that. This is how reflexes work. They're amazing. They can take a lot of information. And of course, what I'm giving you is very different than what most people say. But it's something to take into account. And hopefully, if you start doing that little checklist, you'll start seeing the, oh yeah, I see what I need to work on. And integrate, because even the birthing process, as far as, like I said, setting up your epidermis, your skin, is a really developmental milestone that's meant to take place and doesn't always, especially when there's been birth trauma or premature delivery. Thanks.